Back from Caring Medical Center, I am so happy to welcome our next guest to the show, Dr. Ross Howser, a prolotherapist at Caring Medical Center. Good morning. So great to have you back again.
Yeah, thanks, Stephanie. Thanks for having me.
This morning we're going to discuss C1 and C2 instability, but first I kind of want to brief everybody on exactly what prolotherapy is, and I really want them to understand because this is a fabulous technology.
Oh, thank you. As you know, when people have pain, a lot of times it's hard to figure out what exactly is causing the pain. I always think of pain as weakness. So if your back doesn't hurt with laying down, but when you get up, Stephanie, and then your back hurts, it means there's something in the back that's too weak to support your weight while you're up. Prolotherapy is a treatment that stimulates the repair of structures that support the body, like the ligaments, tendons, joints. So I always think about prolotherapy restarts the repair process. So when your back's hurting, it means that there's something in your back that's injured, torn, or weakened, and the body's having trouble repairing it. So prolotherapy is a natural injection therapy. So we use natural substances that are normally in the body, like the normal sugar, dextrose, or, Stephanie, we can take out the cells from your blood, these specific cells called platelets. Platelets have the growth factors that grow the ligaments, the tendons, the cartilage, or we can get out stem cells, specialized cells from your bone marrow or your fat, and these stem cells can form, these cells have special abilities to form cartilage cells, ligament cells, tendon cells. So it's kind of exciting. It's the first full-time prolotherapy practice here in Southwest Florida. We're in Fort Myers, so we're excited to be here.
We're excited to have you here. And depending on the treatment, there are actually two types of prolotherapy, correct?
Yeah, there's either where we inject natural substances that attract your immune cells to repair the area, or we actually inject your cells directly in there. A lot of people have probably heard about this treatment called platelet-rich plasma. So we take out blood, centrifuge your blood, we get this platelet fraction of the blood and inject it into your neck, your shoulder, your knee to stimulate repair. It's been shown in scientific studies to help things like knee arthritis, meniscal tears, rotator cuff tears, or the low back, like even degenerative disc disease, it helps.
And it helps C1 and C2 instability. Explain what that is.
Yeah, a lot of people don't realize that a lot of migraine headaches, vertigo, spinning room, ringing of the ears, facial pain, chronic neck pain, or clicking or grinding is from C1, C2 instability.
Interesting, interesting. So what are some symptoms that we need to be looking out for to kind of pinpoint if it is C1 and C2?
Probably the most significant one, Stephanie, is when somebody has like severe tightness and muscle spasms at the very top here. The C1 and C2 vertebrae are the vertebrae that support your head. So because of texting, think about texting and the computer work.
We're all down all the time in your hands.
No, exactly. So what that motion does in this position, it stretches the ligaments, and the ligaments are what connect the bones together. So when the ligaments are stretched out, the only thing to stabilize or hold those vertebrae in place is going to be the muscle. So if somebody's getting like chronic muscle spasms here, and especially if they got really terrible headaches, that gets into a migraine headache, and they use medications, or they get chiropractic care, or they get physical therapy or massage, and it only temporarily helps. You got to think of the underlying ligaments are loose, and just like a kitchen cabinet where the two doors are hitting, the only treatment for that is you got to tighten the hinge. So the treatment to tighten the hinges where the vertebrae meet is prolotherapy.
Can you imagine the relief if you are struggling with any of those things that he talked about, the relief that prolotherapy can provide to you? Does Medicare cover prolotherapy, Dr. Howser?
Yeah, right now Medicare doesn't cover prolotherapy, but prolotherapy is affordable. It's in the hundreds of dollars, it's not thousands of dollars. You know, we're working on writing more and more papers. So I've written a lot of papers, including papers on C1 or cervical instability. So hopefully it will, but I would encourage anybody with migraine headaches, chronic neck pain, that isn't getting relief with the things they're trying to consider prolotherapy.
And certainly it's not for everyone, but there are some people out there that this can truly help and provide some relief for.
Yeah, again, if you get temporary relief with massage or heat or manipulation, it's a sign that the underlying joints are loose, the hinges are loose, and what you need is prolotherapy to the ligaments in your neck to tighten them, and then there's no reason then for the muscles to spasm, and then the migraines go away, or ringing in the ears goes away, or vertigo goes away.
As you've seen throughout our segment, they have a fabulous website that can provide a lot of resources, and you can kind of navigate through and learn more about prolotherapy. We thank you so much for being on the show today, and we look forward to having you back to discuss more medical topics.